Dear students, welcome back. In this session, we are going to see the next layer of the anterior abdominal wall after the muscular layer, that is fascia transversalis. This fascia transversalis is defined as it is the inner surface of the abdominal muscles which is lined by fascia, which is separated from the peritoneum by extraperitoneal connective tissue. So here if you can see, this is the transverse abdominis muscle, and next to this transverse abdominis muscle you'll have this fascia, and the next layer is peritoneum. So this fascia transversalis is dividing the peritoneum and the transverse abdominis layer. Okay, and the part of the fascia which lines inner surface of the transverse abdominis is called as fascia transversalis. Okay, now if you take this is the transverse abdominis muscle and this is the fascia, that is extraperitoneal fascia. So the layer which is covering the transverse abdominal muscle, that to inner surface of the transverse abdominis muscle, is called as fascia transversalis. Extent from where to where this fascia is extended. Anteriorly, it is adherent to the linea alba above the umbilicus. Above the umbilicus, it is getting attached. Posteriorly, it merges with the anterior layer of the thoracolumbar fascia. So here if you can see this is the fascia transversalis. Okay, on the posterior side it is adherent to the thoracolumbar fascia. Okay, and it is also continuous with the renal fascia also. Here this layer is connecting the thoracolumbar fascia and it is also connected with renal fascia. Superiorly it is connecting with the diaphragmatic fascia. So superiorly it is connected with diaphragmatic fascia, or simply it is continued as the diaphragmatic fascia. If you come to inferiorly it is attached to the inner lip of the iliac crest. So iliac crest, and then lateral half of the inguinal ligament. At both these places it is continuous with the fascia iliaca. So this is called fascia iliaca. And then medially it is attached to the pubic tubercle. Medially it is attached to the pubic tubercle, the pubic crest and the pectineal line, and part of it is prolonged into the thigh as the anterior wall of the femoral sheath. So part of it prolonged into the thigh as the anterior wall of the femoral sheath. Okay, so this is the extent of the fascia transversalis. Okay, anteriorly it is adherent to the linea alba above the umbilicus. Posteriorly it merges with the anterior margin of the thoracolumbar fascia and it is continuous with the renal fascia. And superiorly it is continuous with the diaphragmatic fascia. Inferiorly it is continued as fascia iliaca, as well as the it is elongated or prolonged into the thigh as the anterior wall of the femoral sheath. So this is about the fascia transversalis. So another important structure which is related to the fascia transversalis is the opening of the deep inguinal ring. So deep inguinal, superficial inguinal ring we have seen, which is formed by this aponeurosis of this external oblique muscle, whereas this deep inguinal ring is formed by this fascia transversalis. Okay, here you can see the opening of the deep inguinal ring. So it is about 1.2 centimeters above the mid-inguinal ligament. For example, this is the anterior superior iliac spine and this is the pubic tubercle, and this is the inguinal ligament. So this becomes the midpoint. So this is the medial half and this one is the lateral half. So this deep inguinal ring is present above the 1.2 centimeters above the mid-inguinal point, and there is an oval opening in the fascia transversalis, and here it is having a oval opening in the fascia transversalis. This opening is the deep inguinal ring. This opening is the deep inguinal ring. The ring lies immediately lateral to the inferior epigastric artery. So it lies lateral to the inferior epigastric artery, and this deep inguinal ring transmits the spermatic cord in males and the round ligament of the uterus in females. So this ring allows the spermatic cord in males and the round ligament of the uterus in females. Now, this prolongations of this fascia transversalis, which is surrounding the spermatic cord. So this is a oval opening. Through this spermatic cord is coming out, and this spermatic cord is covered by a tubular prolongation of this fascia transversalis, forming the internal spermatic fascia. So the fascia transversalis, which surrounds the spermatic cord, forms the internal spermatic fascia. Keep it in mind, very very important here. And over the femoral vessels, next, after it reaches this inguinal part and the spermatic cord, and this one also prolonged over the femoral vessels, into the thigh as the anterior wall of the femoral sheath. Which fascia? Transversalis fascia. So here we can see this fascia is prolonged into the thigh as anterior wall of the femoral sheath. So this fascia transversalis prolonged into the thigh as the anterior wall of the femoral sheath. So that means this femoral sheath covers the femoral vessels. And coming to the relation to vessels and nerves of this fascia transversalis, the main arteries of the abdominal wall and the pelvis lie inside the fascia transversalis, while the main nerves are outside. So because of that reason only, the femoral sheath contains only the vessels, that is femoral artery and vein, and the sheath, outside the sheath, will have the femoral nerve. Inside the sheath, only femoral artery and femoral vein is present. Okay, this is about the relations to vessels and nerves. So this is about the next abdominal layer. After the abdominal muscles, that means next to the transverse abdominis, this fascia transversalis is present. This is about the fascia transversalis. Here the very important thing you have to note in this is this fascia transversalis forms the opening of the deep inguinal ring, and it is this fascia prolonged as internal spermatic fascia of the spermatic cord, and it is also prolonged into the thigh as anterior wall of the femoral sheath. This is the importance of this fascia transversalis. In the next session, we are going to see the inguinal canal. Thank you.